The end of a coronavirus. The coronavirus pandemic, also known as the COVID 19 pandemic, is an ongoing global pandemic of coronavirus diseases 2019. It is caused by a SARS-CoV-2 severe acute respiratory syndrome coronavirus 2. It was first identified by an outbreak in Wuhan, China in December 2019. It is still known how the COVID 19 outbreak will stop even after more than 2 years of its outbreak. The degree of international collaboration, fair access to the diagnosis, medicine, vaccines, local government action, and citizen response. Concurrent outbreaks, armed conflicts, or natural catastrophes are only a few of variables that might affect the outcome globally. An emphasis on the elderly and other vulnerable groups as well as those in low and middle income countries will be necessary to end the pandemic. Living with pandemic. According to the numerous sources, the pandemic is here to stay, and the World Health Organization is making a similar suggestion. WHO experts are now debating how and when declare an end to the global COVID-19 issue. As we enter the world year of pandemic, Bloomberg said that although the number of COVID-19 related deaths has decreased, the number of cases appears to be increasing throughout the world, with China reporting the world outbreak in the past 2 years. The situation has changed to drastically that nations are now thinking about living with COVID. Scientists have predicted that normalcy won't return anytime soon due to the ongoing appearance of new variants and unequal vaccine distribution. The United Nations Health Agency recently released a statement stating that they are currently concentrating on what circumstances will eventually indicate that the public health emergency proclaimed on 30th January 2022 is gone. Only if about 70% of the world's population receives vaccination would be the pandemic end. Given the history of pandemics, it can be challenging for international health organizations to determine when a disease outbreak has concluded. The World Health Organization will eventually decide when enough nations have sufficiently reduced their COVID-19 cases or at least hospitalization and deaths to formally declare the epidemic over. It is unclear exactly when that time will come, even when the when that occurs. Some regions of the world will still face difficulties, particularly low income nations that do not have access to enough vaccines or treatments, while other regions will transition more readily to what scientists refer to as an endemic state. One of the first countries to start referring to COVID as an endemic is Spain, which has also claimed that people can survive the later seasonal outbreak. A disease may still be fatal even if it is endemic, according to scientists. Emergency of a new variants. Beyond the levels of a pandemic and endemic, the Scientific Advisory Organization for the UK government says scientific advisory group for emergencies has presented further scenarios. These outcomes have been foreseen for future years. As less number of flu cases result from the increased COVID infections, there will be fewer regional or seasonal outbreaks under the realistic best case scenario. According to AFP News, according to the world case scenario, the super unpredictable arising variants would develop into recurrently harmful unknown viral waves necessitating the introduction of a heavy restriction. The two main unknowns that affect the outcomes are the potential appearance of novel variants and and uh, and the long-term efficacy of vaccines in preventing the disease. The introduction of new variants continues to worry people everywhere. There is little assurance that vaccines will protect against upcoming variants, even though they are still effective against the newly occurring Omicron sublineage BA2. Government that have loosened restriction must therefore continue to be watchful and be quick to adapt the changing circumstances in order to set up mitigation efforts in case of a resurgence. High income nations with a strong health systems available to effective antivirals like return higher boosted nirmatrelvir and modern booster vaccine should be able to respond successfully if a new variant appears. On the other hand, if a novel variety spreads widely, low income nations with the weakened health system and little access to antivirals or vaccines will comfort a significant challenge. The way forward. The options, three options for ending this global pandemic are possible according to the trajectory of vaccination rates and government response. In order to help end this pandemic globally and to be ready for the worst case situation, government should prioritize these following three things. To begin with, ensuring that COVID-19 vaccines are produced, supplied, and distributed fairly in essential for boosting global immunity and increasing full vaccination rates. Donations of vaccines are admirable but unsustainable. The pandemic's end is being slowed down by poor vaccination rates in low income nations. Inadequate vaccine equity means that COVID 19 will continue to disproportionately affect low income nations, even if high income countries see a reduction in regional outbreaks. In low income countries, there is also a need to encourage and strengthen local and regional vaccine research and manufacture by urgent waivers of intellectual property rights and license as well as the sharing of a technological know-how. Every government must have a public health strategy based on scientific data that enables quick action in the event that a new variant poses a concern. Regular risk assessment through surveillance, the ability to reintroduce efficient and affordable public health measures like masking, avoiding disruption to critical health services, and rebuilding public confidence in government through open, prompt, and a transparent this communication should be adopted. Plans for decentralized decision making need to be supported by economic autonomy since provinces, states, and or developed nations may not be able to execute timely actions inside their own countries due to financial decisions made at the federal level. People who are most vulnerable must be protected first. This is both a moral requirement and a crucial for putting a stop to the pandemic. Consideration should be given to the two categories of vulnerable populations: those who are more vulnerable to SARS infection, such as healthcare professionals, and those who run the risk of developing severe COVID 19, such as the compromised immunocompromised. Healthcare professionals must also be protected in addition to those who are at high risk for serious infections, since they have experienced stress, anxiety, burnout, depression, insomnia, and other negative effects on their mental and physical health due to danger of infection and increased workload. A parade of or are agreed upon umbricial do not signal the end of a pandemic. They come to an end when other more important day-to-day issues take precedence over the condition. In the end, countries will have to choose what levels of transmissions are acceptable, how to regulate the virus without taxing health system, and how to avert negative health and socio-economic economic repercussion in a globalized environment.